All right. Well, good morning once again. My name is Tomar Pierson-Brown. I am a clinical assistant professor here at Pitt Law, and I'm the director of the Health Law Clinic. The Health Law Clinic is a medical legal partnership between the Hickton Center for Community Legal Services and Clinical Legal Education at Pitt and the UPMC Children's Hospital. It is my pleasure to serve as the moderator for today's panel discussion. This panel discussion in Town Hall was inspired by one of our Pitt 2Ls, Christian Roberts. So thank you, Christian, so much for inspiring this. Today's panel is titled Law as a Social Determinant of Health, Legal Responses to the COVID-19 Pandemic. Social determinants of health are the conditions and the environments in which people are born, live, work, play, age, and worship that affect a wide range of health functioning, quality of life outcomes, and risks. Law is the ultimate social determinant of health. The legal framework undergirding each social determinant dictates who will have access to the social and environmental resources necessary to health. In this season of pandemic, the relationship between law, public policy, and health outcomes is in stark relief, but the work of framing and critiquing public policy in terms of its impact on public health is not new. Advocates for racial, international, criminal, and economic justice have long since raised the adverse health consequences of our legal institutions, policies, and practices as a basis for reform. What is unique to this moment is the universal discomfort that the novel coronavirus has visited on each of us, foreclosing the opportunity to look away. The consequences of global pandemic are all around us. In this time of shared interruption, we have a unique opportunity to learn how the consequences of this virus have been shaped by or has impacted several areas of the law. Joining us on today's panel are Professors Matiange Sirleaf, Tony Infanti, Phil Hackney, Sheila Velez Martinez, David Harris, and Mary Crossley. They will share their expertise and perspective on the impact and consequences of the coronavirus. As you have questions for our panelists, please enter them to me in our group chat in the comment section of the Zoom so that we can address them throughout the presentation. This event is being recorded and an edited version may be posted to the Pitt Law website at some point in the future. Once we've heard from our panel, the recording will stop and we'll move into a brief town hall session, giving you, our audience, the opportunity to share any of your responses to the pandemic. I'm going to turn it over to Professors Infanti and Professor Hackney.
Thank you so much. So I'm Professor Infanti, and Professor Hackney and I are going to be talking to you about the tax law responses to COVID-19. And I thought a nice place to start would be, because usually people are pretty skeptical, like the tax folks always want to talk about tax. We think tax is so important and that, we view everything through this lens of tax, but we're not the only ones that do that. I thought it would be helpful to kind of juxtapose here two different things. I mean, on the top, you see a headline from the New York Times from March 12th, talking about how President Trump was proposing a payroll tax cut that would have dwarfed the 2008 bank bailout. It would have cost more than $1 trillion. And in fact, just in the past few days, President Trump has been pushing for a payroll tax cut, again, that neither back in March nor now is being well received by Congress. But you see him pushing for this payroll tax cut, talking about taxes, and that was before he actually declared a national emergency, which wasn't until the 13th of March. And then you'll see on the bottom of the slide, it wasn't until the 16th of March that the White House issued its coronavirus guidelines for America that were supposed to help slow the spread of the disease. So even before, the White House is really talking in earnest and seriously about how to slow the spread of this disease across the country, they're talking about how to give tax relief to people, which kind of is a nice juxtaposition that shows you where people's priorities are. And so what we're going to be doing during our time is talking to you some about the different tax responses to COVID-19 and some of the problems with those responses and some of the inequities. So the CARES Act which was enacted at the end of March, is kind of the main act that contains tax provisions. And there are a bunch of individual tax provisions that I'm going to talk to you very briefly about here now. There are also some business tax provisions that Professor Hackney is going to talk to you about in a moment. And then we're going to talk a little more deeply about the first three here, because they're the ones that are usually kind of more interesting to people, kind of broadly speaking. So the individual tax provisions, the one that's probably the most known is the recovery rebates, what people call the stimulus payments, the economic impact payments. They're actually in the legislation called recovery rebates for individuals. And then there's also a temporary relaxation of restrictions on retirement accounts to let people get access to the money in their retirement accounts. Incentives for charitable giving. And then there's one that doesn't seem to make the news a lot, but there's a temporary exclusion for employer repayments of employee student loans that's in there as well. But like I said, we're going to talk about those first three, the recovery rebates, the temporary relaxation of restrictions on retirement accounts, and the temporary incentives for charitable giving a little bit more. But I'll turn it over to Professor Hackney now just to talk to you for a bit about the business tax provisions.
Thank you, Professor Infanti, and thank you, Professor O and Tomar Pierson and Dean Wildermuth and everybody for making this possible. I think it's critical to be thinking about this stuff as we're going through it. It highlights so many aspects of the relationship of law to society, and this is a great opportunity to explore it. I've given a few presentations on the types of things the CARES Act does. And it really gets you to think about what's going on here, right? We're in the middle of a pandemic. So our first concern in some sense is health, but we're also in the middle of an economic shutdown. And those two things conflict and are related to one another. So some of the things that we need to do are protect people from the harm that they might experience, both from the virus and from the economic harm. How can we quickly get dollars out to folks through the tax system? And we're going to see that in a variety of ways. Lots of folks have written about this, including Professor Infanti, is thinking about, and I'm thinking specifically about Professor Infanti's book, thinking about the reflection that this structure gives us back to us. It just happens that we're able to get dollars out to people quickly through the tax system. But it also happens that the dollars that we get through the tax system often help certain individuals over others. Those who are not in a work system aren't typically getting dollars. It's harder to get those dollars. Those that are in work are valued at a higher level. And it's work that we consider, and jobs and running businesses. Running businesses is thought of as higher. So let me talk about some of the provisions that came in the CARES Act. We have a number of things that are thinking about work, right? The first one there is the temporary employee retention credit against payroll taxes for businesses closed during COVID-19. So they will get you up to $5,000 per employee that you keep on staff. This is for large employers. But it's something that any employer needs to think through. It's really a blizzard of provisions that Congress put out there, and what individuals have to do is hopefully have someone who knows what they're doing to figure out how to access these dollars. Another one they did, I've thought about this with a friend of mine who owns a beignet place in Louisiana. There's a deferral of the employer portion of the 2020 Social Security taxes. So employers can keep an employee on, hold the dollars that they would have been putting aside, the 6.2% that they would have put aside for Social Security, and wait and pay it in 2021 and 2022. It's effectively a 0% loan through this payroll system to employers that can take advantage of that. There's a temporary relaxation of business losses and interest deductions. If there's a thing that's out there in the press that you've seen where folks really wealthy individuals got money, it's this one. Again, Congress is trying to get dollars immediately out to make sure that the economy doesn't shut down and folks have access to dollars to move in the economy and get money to employees. But this probably inures to very wealthy individuals. In the 2017 Act, they had clawed back certain abilities to take losses against other things in order to give massive tax reductions. All of a sudden, they've given these losses back, and it really accrues to wealthy individuals. They also fixed this thing called the retail glitch. I don't think it's worth going into depth into that again. That's going to accrue to high income taxpayers rather than any individuals trickling down to employees. Those first couples probably do help out folks. The most massive one is this SBA loans, Forgiveness of CARES Act SBA loans. This is the PPP, and they have managed to give dollars through SBA that are forgivable, and they don't go into your gross income from a tax perspective. The interesting thing here is the vehicle through which they chose to get these dollars out there. They're through your banks. So this has a racialized, a genderized effect in terms of who has access to this money. Again, it's thinking through the system that we've just structured the benefits has a real impact on who's getting help in this situation. Temporary elimination of excise tax on distilled spirits used to make hand sanitizer. And we've seen folks even here, I think Wiggle Whiskey was using that. And then there was also, and I'm not going to go into this, but this final one here regarding paid leave. There was an effort early on, you may remember, to give paid leave to everyone so folks wouldn't feel compelled to come in. This provision only helped out smaller employers, didn't get massive employers, so larger employers don't have access to this. And I want to turn it over to Tony for the next part.
Okay, and before I switch over to the next part, I just wanted to comment on a couple of things on this slide with the business tax provisions. One is just that temporary relaxation limitations on business losses and interest deductions, as Professor Hackney said, really hits very, very large businesses and very, very wealthy people. And the cost of that is about $239 billion is what's going there. And the retail glitch is just noting, we're in the midst of a crisis, but people are still lobbying and trying to get things that they've been trying to get ever since the Tax Cuts and Jobs Act was passed, to try to get money for themselves when the focus really should be and is supposedly upon trying to help people who are hurting economically because of the after effects of everything that's going on. And then just on that first one, the second one, deferring the Social Security taxes, there's been some talk about that one that, part of here you're seeing the difference between smaller businesses and bigger businesses, that some people are saying that this deferral of the Social Security taxes is like a ticking time bomb for some businesses, because they're putting off this liability that seems like a great thing, but they have to pay it later. And if things aren't turning out better, then they're on the hook for something that they can't afford to pay back. And so, for businesses that aren't doing as well, that could be a ticking time bomb. Hold on. There we go. So now let's turn to talking about the recovery rebates, or the economic impact or stimulus payments, as they're more commonly called. And so this one, the government's giving money to individuals to try to help them through this very tough time. And people think the government's just giving out money. Well, the government's actually not giving out money. What they're doing is they're running it through the tax system. And this is actually a refundable tax credit for 2020. And you can see here, some of the details. For each individual filer, it's $1,200. Married couples filing jointly get twice that amount, $2,400. Plus, you see $500 for each qualifying individual, for each qualifying child. And qualifying child has to be a child who's under 17, live with the taxpayer for more than half the year. And then there are some other requirements as well. But that under 17 is why I'm seeing particularly some students not getting, especially college students not getting the $500. Their parents not getting it for them. It's phased out. You see individual filers with adjusted gross incomes above $75,000. They start phasing it out. It's fully phased out for them. Similarly starts phasing out at $112,500. It's fully phased out at $146,500 for head of household with one qualifying child. And for married couples, it starts phasing out at 150,000, fully phases out at 198. Some interesting points here about who's ineligible. So non-resident aliens are ineligible. Any individual who can be claimed as a dependent by another taxpayer. That's another reason why a lot of college students are not able to get it themselves. Is because even if their parents are claiming them as a dependent or have claimed them as a dependent on their taxes, then they're not going to be eligible themselves for the credit, even if they're earning money. And then you see those without Social Security number that's valid for employment aren't eligible. And the thing that's interesting about this is that it infects basically the whole family. You have to have a Social Security number valid for employment for the taxpayer, for the taxpayer's spouse, if the taxpayer is married and they're filing jointly, and for the qualifying children as well. If any one of them lacks a Social Security number that's valid for employment, then no one gets the credit. And there have already been class action lawsuits brought about that, arguing that it violates the Constitution, violates First Amendment rights, violates equal protection to deprive people who are otherwise eligible for this from being able to get the benefit of the rebates just because of who they're married to or who they live with. And you see just the mechanism for getting to people now is that it's treated as an overpayment of taxes from last year, the year before. If you didn't file taxes in 2018 or 2019, you can still qualify. And you can see here for people who don't receive Social Security or other federal benefits, they have to go to irs.gov and enter their information. But there are concerns that have been raised about privacy because the website that they use for that was constructed, managed, and maintained by Intuit. It's not maintained by the government. And there's some worry that they're going to be using that to try to push free file to paid products for people. And then you see the credits reconciled on returns next year. So, happily for people who, get too much credit in advance, they don't have to repay the excess. So if you have a kid who was under 17 in 2019, but turned 17 in 2020, you're not gonna have to repay the credit for them. If you receive too little though, or you get nothing, you can get the credit next year when you file your tax returns. The one other thing that's been very troublesome is that even though Congress carved out the collection of federal debts and state debts from these rebate payments, there have been reports that private debt collectors have been seizing some of the payments. Treasury's investigating its authority to end that practice, but after a couple weeks, there's been no word from them about that. And I'll turn it back to Professor Hackney. You're muted.
All right. I think, right? Okay.
You're on now.
Am I still muted?
No, you're good.
No, you're on.
Okay, good. Sorry. Retirement provisions. This is one that I think of as part of trying to get through to the other side of this thing, right? There are, some people have accounts that they can use. Now, as we think about the retirement provisions, just remember that most people in the United States do not have the dollars that they need to retire. So this is a provision that comes in that is not super effective for a lot of people, but it's one of those things that I think of as emergency break glass. So for those individuals who are in a spot where they have retirement, these provisions may come in handy if they need to. So first thing that they did is they waived the minimum requirement for IRAs in 2020, including for inherited IRAs. So those who are worried about the downfall in the market and happen to have retirement and are trying to make sure that they can extend that retirement out without taking up too much, there is the possibility of letting that retirement stay and not having to do that payment out this year. That's not immediate, but that's for longer term folks who are trying to make sure that they have enough dollars there. But again, just thinking about that aspect in terms of who it helps. It eliminated, and this is more for folks that immediately, so these are individuals under 59 and a half, it eliminates the 10% penalty for some withdrawals from retirement accounts up to $100,000. You still have to pay the taxes. It still comes with cost, but you can take dollars out. And of course, it has an impact on your ability to retire in the future. But if you're in the position where you've just lost your job and you have no way to make ends meet, this is something that someone might consider. In order to have access to this, you or your spouse or dependent must have been diagnosed with COVID-19 or have suffered some financial consequence associated with this. It's pretty loose. It's your financial plan that's going to be managing the determination as to whether this is done or not. Again, there's some interesting aspects here where we are giving out decisions to be made by private parties, in particular control, to determine who has access to these things, which has a real impact on individuals out there in the public. It also doubled the amount that you can borrow from a qualified employer plan. So if you don't want to take those dollars out, you can actually borrow those amounts, and it delays the repayment scheduled for 2020. There's a lot of details in these, and they're moving in terms of how they can be done, but they are some interesting provisions. Let's move on to the charitable one so we can keep ourselves on time here. So what about charitable giving? There's been a long effort by the charitable community to get a universal charitable deduction. In the 2017 Tax Act, Congress seriously increased the standard deduction, over $12,000 for an individual and over $24,000 for a couple filing jointly. That meant that most people don't have access to taking a charitable contribution deduction. What they did here is they created an above-the-line deduction of $300. Everybody will have access to this. A quick study of this, though, just for what it's worth, is it's going to cost about $2 billion for this temporary deduction, but only about $100 million is going to go to charity. So it has this look of actually getting dollars to charity, but it's really probably not. It creates a problem for fraud for the IRS. They have no way of checking. Essentially, you're going to have some folks take this without giving the money. You're going to have some folks give the money and take it. It's not a very effective provision in the way it was done. It also goes in greatest amount to those individuals who have a higher tax rate. So if you're paying at a 37% rate, you get 37 cents on the dollar. If you're paying at a 0% rate, you get 0 cents dollar back from this particular provision. They did a bevy of other things for wealthy individuals. They eliminated a 60% ceiling, which is the adjusted gross income for the year. So this year, you can make a cash gift of up to 100% of your adjusted gross income. Most individuals don't have access to this, but if you're in that fortunate place where you do, it might get dollars to charities where they're needed. The difficulties within the charitable world, again, is we have no way of ensuring these dollars are going towards COVID-19 things or individuals who are really suffering in these situations. By the way, give to your local food bank if you can. They need it desperately, and you can take a $300 charitable contribution deduction. They did a couple things for corporate organizations, and they did some stuff for food, but I want to move it back on to Tony.
So that what we're going to close out with is some of the things that the IRS has done. And so you can see that the IRS, well, IRS and others, I should say, the IRS extended a long list of filing payment deadlines to July 15th. There was a little bit of confusion in the beginning, but so they've moved, both the filing and the payment deadlines, a lot of them, the regular April 15th deadlines off to July 15th. The IRS also adopted this People First initiative that suspends payments under installment agreements, suspends new liens and levies. And they're doing things to try to kind of relieve the burden on people who are being either audited by the IRS or dealing with the IRS. And you can see a number of state tax authorities have followed suit. There's a really long listing in Bloomberg's state tax coronavirus roadmap that gives you a laundry list of everything all the different states are doing. But one thing that's really important to note is that a lot of the states are going along with this, pushing back the deadlines because it's a psychological burden and also a time and administrative burden for people to file their taxes and more importantly to have to pay their taxes right at this time when people don't have money, don't have jobs. But, for the federal government, that's one thing. But for the state governments, it's very different because the state governments, usually have to balance their budgets. And this payment, especially the payment relief that the states are providing, can cause them really a strong cash crunch. In fact, there was just some reporting yesterday in some of the tax news about California and how in April, the number of returns that California received was about half of what they normally get. The amount of money they got was far lower than what they usually get. So, there are going to be, a lot of the states are going to be experiencing a significant cash crunch in the short term because of all of this relief that's provided to taxpayers. So that was, I'll just turn it back to Professor Hackney if you want us to.
Yeah, I'll close out with something. The biggest battle right now is whether Congress is going to back up states because they really need money. They're going to be soon, well, they already have. Pennsylvania already let go 10,000 people. There's a real need at the federal level to get those dollars out to those states. It matters for jobs and the response, but I'll finish there because I think we're kind of at the end of our time.
Yeah.
Thank you so much, Professor Hackney and Professor Infanti. That was really informative and really helpful to give us some more context between how the virus has impacted some of the changing laws affecting our taxes. Again, I'm going to encourage those of you in the audience to, if you have questions for Professor Sirleaf, Professor Hackney, or Professor Infanti, to please enter those into the chat. While you are doing that, I'm going to go ahead and turn the screen over to Professor Velez Martinez.
Hello. Hi. Thank you, Tomar and Peter, for this initiative and for inviting me. So I'm going to have sort of a more critical theory approach to this issue of law as a social determinant of health, because we live in critical times and there's a shared unease about the future, and the pandemic has caused a global disruption. And before it's over, it would have killed hundreds of thousands of people from COVID-19, but arguably even more due to famine and other global disruptions. And this has, of course, hopefully, incited a crisis of confidence in leadership, and for the amusement of some of us, an interesting redefinition of what American exceptionalism means. But this is also a historic opportunity that I fear might go to waste if we do not use it to change our political imaginaries. It's a critical time for critical theory and an opportunity to look at law and how law is complicit in furthering the systemic inequalities that have become transparent by COVID-19. So my approach to this comes from a Latcrit perspective of anti-subordination, a positionality of anti-subordination, which commits us to challenge all practices and policies that by intent or effect enforce the subjugated social status of historically oppressed communities within our societies. And you saw some of that in Professor Sirleaf's presentation earlier today. And this society that must now be defended is all the policies, the regulations, the proclamations that we have been listening to are related to protecting society. And this brings us to a conversation about how these times are Foucauldian times. I mean, and are the Foucauldian times of our lifetimes, because there is nothing that calls forth biopolitics and biopower like a pandemic. Governing in times of COVID-19 is biopolitics in its purest form. And when I when I mention and I talk about biopolitics, I'm making reference to a political rationality which takes the administration of life and population and its subject to ensure, sustain, and multiply life to the advancement of society. So biopolitics relates to a distribution of the living in the domain and value of utility. And in our society, that means the distribution of the living in the domain and utility in furtherance of capitalism. Biopower, it's that precise controls and comprehensive regulations that create that grid for that distribution of life. And biopower, and Foucault, it's consistent throughout his writings that power is diffuse, and there's certainly some of the biopower that it's moral and social and we've seen this when people are engaging in discussions and shaming of those who are not wearing masks, of those who are not socially distancing. There have been even tragic incidents regarding masks and who is behaving in a socially moral way. But law still has a primordial role to play in this, because law has the privilege of violence, of authorized violence. Law is the norm that can be enforced by the state through authorized violence in the way that someone killing someone else for not using a mask is not authorized. And I laugh because David Harris has heard me talk about this before in class, so I'm sorry that he has to endure me again. I'm sure he won't mind. So law then, it's part of the instrument to sustain life through that exercise of authorized violence. But what happens is, and I think Martin Gay brought this to light, is that not all life is equally valued. And that brings us to the conversations with Judith Butler about value of life, and how not all life is equally valued, but not all life is equally grieved or worthy enough to be equally grieved. So the laws and regulations serve this purpose of directing and distributing which lives are more valuable and which lives could be grieved in a different way. So laws then execute a judgment over life and death. The laws, the proclamations, the regulations that we have been seeing under the pandemic emergency have determined who is essential, who is expendable, who is to be protected, who is to be tested, who is to be treated, who is to be compensated, like Tony and Phil explained some minutes ago, who gets to be cared for, and who gets to come in to the United States, and who gets to remain in the United States. So it's ultimately a decision of who gets to live. And we saw that very clearly in this manufactured debate of the cost of reopening versus the values of life. So we've seen a widespread debate in the United States about how many lives are we willing to give up to be able to restart the economy and continue with the economy. And I think that the stark example, it's probably the state of Georgia. And I have been following Georgia politics and issues very closely for the last couple of months, probably more than I should. But that decision of Governor Kemp to reopen the state comes together with a report from the Center for Disease from the CDC that says that 83% of every person, of all the people hospitalized with COVID-19, 83.2 to be precise, are African Americans. The population of Atlanta Metro, it's 35% African American. So that decision to reopen the state, it's a clear decision that assigns values to lives, and which lives are we willing to be expending, and which lives are more valuable. So it's safe to say that we can reopen Georgia, because which are the lives that are more likely to be lost? And that has been also true in the context of the policies, proclamations, regulations that have been impacted immigrant communities in the United States. So if COVID-19 is the disease, it's true that COVID-19 is the disease of stoppage and social distancing, but as Boaventura dos Santos has said, it's also the disease of transparency, of the transparency of privilege and inequality, because social distancing, it's an exercise in privilege itself. So only a few have the privilege of being able to socially distance. And for us to be able to socially distance, there are millions of people that are going hungry or that are exposing themselves because they don't have that option to socially distance. So COVID-19 is also a metaphor of our times in general, and it's also a metaphor for the experiences of immigrants in the United States in particular. Walls of separation have already been built. Families have been separated. Children taken from their parents to the point that the government still doesn't know where are the parents that they took the children from. Borders closed. Refugees already rejected. Asylum already curtailed. So that was even before COVID-19. So COVID-19 has also provided an additional discourse in the name of defending society. And then we get a little bit back to Foucault. This society that have been defined as this in exclusion of the other. So there's a clear definition of which is the society that we're defending. And if you read the proclamation, especially the last one, it says, we are protecting Americans, and we are protecting Americans' jobs and Americans' health, and we want to give incentives and stimulus to Americans. So post-COVID-19, we have an effectively border closed. The migrant protection protocol cases have been suspended. The hearings in immigration courts in detained cases have continued. Attorneys have to continue to represent and risk their life and provide their own protective equipment to be able to do so. Detention policies have continued. There's no stimulus access for binational families that have at least one member that has an ITIN or doesn't have a social security. Ban on legal migration to the United States most recently. So it's an increased state of precariousness within the immigrant community. But I want to end saying that with all its death and destruction that COVID brings, and I'm gonna quote Boaventura again, it also brings tremendous clarity that bring to light what he calls are the three unicorns of oppression. And don't ask me why unicorns. That's his capitalism, colonialism, and patriarchy. So the way we choose to interpret and assess this crisis will determine the future of the civilization that we live in. This is that important. And in terms of law, we have to move towards a law that reflects a radical reimagination of humanness, of what it means to be human in this world. But for the time being, we will need to continue to stay socially distanced while, and very importantly, remaining critically conscious. Thank you.
Okay, sorry about that. Thank you so much, Professor Velez Martinez. Please, in the audience, as you have questions, continue to add them to the group chat. And at this time, I'd like to turn the screen over to Professor David Harris.
Okay, hi. I want to thank Professor Pierson-Brown and Professor O for organizing this. Thanks to Christian Roberts for the suggestion from our student body. You know, what I'm finding both interesting and horrifying, what's really grabbed my attention in this pandemic, is how it is bringing to light and exposing and exacerbating so many of our existing social problems. It's certainly happening in health, and you can see that all around us. But what it is doing to highlight some of the deepest and most entrenched problems in the criminal law system, I think are extraordinary. And it is calling attention to some of these problems and even pushing certain aspects of the long-term reform agenda, pushing it much faster than we might have seen some of these things. It's not clear that that these changes will last past the pandemic itself, but it is forcing people who don't want to come to grips with some of our very difficult problems in this sphere to actually see how bad things are and to view the depth of some of the mistakes that we've made. I'm going to focus most of my comments on what we see in our system of mass incarceration, what's going on in prisons and jails, and the people who we have sent there, or in the context of jails, the people we're not allowing to leave those institutions even though they're innocent. But we can also see some of these problems in other criminal justice spheres too, and with other criminal justice actors, people like police officers, like corrections officers, like the family members of incarcerated people, like public defenders and prosecutors. All of these roles, all of these people are being impacted by this. And if we were to pay attention now, we could actually see some ways in which great injustice has been living with us for a long time. And those of us who perhaps haven't thought about this a lot, we should not ignore these problems anymore. They are too big to ignore, and if we ignored them before, we certainly can't now. So let's just take a minute and talk about prisons and jails. The impacts here are very direct, and they force us to confront the kinds of choices we've been making for decades now, and the impact that these have on our fellow citizens and human beings, and the society as a whole as well. We've been making these choices for 30 and 40 years in this country in ways that haven't been made in other countries in the world, even ones that are quite comparable to our own. This pandemic is really showing us how wrong some of those decisions are. Even to those of us who might have supported them in the past. I think it's important for everybody to understand the difference between prisons and jails, in case this isn't your area or something you've looked at. When we talk about prisons, these are the places that we send people who have been convicted of crimes. They can be federal, they can be state, but in point of fact, most prisons are are state, and the state prisons hold most of the incarcerated people in this country. The federal prison system is quite large, but it isn't even one of the biggest players. The action in incarceration is really, for the most part, in the states. Federal prisons hold collectively about 12% of all of our prisons. Some people who are convicted of crimes might be held at a local level in a county jail, which I'll talk about in a second, but those are usually only people on short sentences of, let's just pick a number, a year or less in most jurisdictions. In Pennsylvania, we have 48,000 people in state prisons right now. This is down a little bit from a few years ago, and the downward trend from roughly 50 or 51,000 down to 48,000 has been cited as a sort of great victory in the effort to decarcerate. I'll talk more about that in a few minutes. Federal prisons in Pennsylvania hold 7,500 incarcerated people. Jails are different. Jails exist in Pennsylvania in every county. In some other states, it's a group of counties called a district. But what jails are they're obviously places where you can't go out. They are like prisons in that respect, but they hold people there who are either on those short sentences of a year or less, but for the greatest number of people in jails are people who are there awaiting trial. So in other words, like I said at the beginning, they're not convicted of anything. They're completely legally innocent, and they are simply waiting for trial. Why are they waiting for trial? Because in general, most states use a cash bail system, and if you can't pay for the bail, you wait for your trial inside. And this has been a major problem that's been on the radar of people interested in creating change in the criminal legal system for a long, long time. Cash bail is a real point of difference with almost every country in the world, because bail is set by judges. It is supposed to be only for purposes of assuring your appearance at trial. Yet we know that it is set also because judges think that if this person got out, they would be dangerous. So people who have bail set but who are able to pay it, who have financial resources, can get out before trial to the great benefit of their cases, the benefit of keeping their jobs, their housing, and all kinds of other resources intact. They can get out no matter how guilty they might be. A person who has very little in the way of resources, who can't pay a $250 or a $500 or a $1,000 bond, that person stays in even though they may be as innocent as the day they were born. This is something that is stuck out, like I said, as a long-term problem. In jails in Allegheny County, we have had consistently a jail population of about 2,000, sometimes over, sometimes a little under. I'll talk in a few minutes about what's happened to that in this crisis. The basic problem we have in our system, as many of you are probably aware of, is we have a lot of people incarcerated in this country. When I say a lot, I mean a lot, not just numerically. We have well over 2.5 million, but we have proportionally a huge, huge number of people. We have roughly 5% of the world's population. We have about 25% of the world's incarcerated people. Let that sink in for a minute. Everybody likes, you know, as Americans, we're all about, we're number one, right? Well, here, we're number one, and it's just not a great thing. We incarcerate not only more people, but we incarcerate them for much, much longer than any comparable country that you can think of. We use life without parole sentences in a way that no other country does. Pennsylvania is number one in that category. And all of this contributes to the basic baseline problem that we have not faced up to yet, and that the pandemic is forcing us to at least look at. It is exposing this problem. The problem here is we just have too many people in prison for far too long. Now, what's going to happen with prisons in the pandemic environment? All right. I suppose it's obvious, though the crisis is really just starting to peak now for people inside prisons. Consider the prison or the jail environment. Any of you who have gone inside prisons or jails to do work, as I have, or maybe you visited somebody inside these places, several characteristics are going to stand out for you. Number one, these are dirty and unsanitary places, despite the regular kinds of efforts to keep them clean. They're not clean. They're just not. They're unsanitary. There aren't enough places to do things like wash your hands. They're not allowed to have things like sanitizer within prisons. It's contraband. Because of the alcohol in it. It can be used that way. It can be weaponized and things like that. Number two, they are crowded places. Even in prisons that are not suffering from overcrowding, generally you have 2 to a cell. A cell is a very small area like a closet or a bathroom. And you have 2 men living in these cells, 2 women living in these cells. Obviously, social distancing is just not something you can do in most prisons. They're just too crowded. They're not made to have the kind of distance that our public health officials are looking for. Beyond that, healthcare within prisons is not what anybody would expect or accept out in the rest of the world. It is often a small affair. It often delivers substandard care. People are not given the kind of medical attention that they need, even for garden variety things such as the flu or a cold or even basic injuries. All of this combined together, what do you think is going to happen inside a prison environment? COVID-19 is going to break out, and it's going to be devastating, and the numbers are going to be huge, and they're going to overrun these places, and we're already seeing that that is beginning to happen. And by the way, this will not just impact the incarcerated people who we've sent there as a matter of our legal judgments. This is going to impact the entire staff of these places, the corrections officers, the psychologists, the medical people, the folks who go in and out to repair things. They're all going to be affected by these things too, and they're going to bring it back out to us, to the rest of us who live in the free world, if you want to call it that. Prisons will become, some of them have already become COVID-19 hotspots with huge and growing numbers of people infected. Now, if that's what prisons will look like, and the picture there is grim and getting grimmer, jails present a slightly different picture, but not a better one, because if anything, you have a more dire circumstance in that jails are located in counties. They're located closer to towns. They're not out in these rural areas as many prisons are. And the turnover in jails is much, much greater. People go in the night that they are arrested, typically in jails. Most people get arrested in the night hours. And even those who can bail out come out the next morning. They're in there for a while, then they come out. The staff, of course, is going in and out all the time. But there's much more turnover of the population in a jail than in a prison. Even a big prison, they'll let out, X number of people a day when their sentences are over. They take in roughly the same number of people a day for the start of new sentences. Jails are turning people in and out and in and out all day and all night long. So they present a real public health problem. So what do we do? What should we be doing? Let's just be practical here. Let's do the right thing. We got to get people out. Get people out of these places now, and we got to get as many of them out as we can. Has this happened? Well, a little bit, not nearly as much as is needed. The transfer of people out of prisons, even the medically vulnerable and the elderly who are within prisons, has been far too small to stop the spreading and to stop the outbreaks of diseases. What you hear from officials is we're looking at the nonviolent incarcerated people, the drug offenders, the first-timers. All that's to the good, but it's not nearly enough because those people don't make up the great bulk of our prison populations. As I've said, we put too many people in, but we put them in on long, long sentences. Much longer than any comparable country does. And we do this in spite of the evidence we have that it's unnecessary for public safety, right? What do I mean by that? One of the leading researchers in this area in the entire country and in the world, frankly, is Dr. Al Blumstein of Carnegie Mellon. And he showed decades ago that crime was really a young person's game. He looked at all the numbers that were out there, and by the time a person reaches the age of, say, 35, certainly 40, they've aged out of any kind of career of violent crime. It's the great exception of a person who at that age would get back into that sort of activity once released. So we could, without any additional risk to public safety, release everybody from prison over 50 years old, everybody from prison over 40 years old with no risk at all. Doesn't mean that you wouldn't have some kind of a tether on them, perhaps, if you really insisted on it. But we couldn't, instead of releasing a few hundred or a few thousand people from a state prison system, we should be releasing tens of thousands, hundreds of thousands nationwide. Our prison system should be much, much smaller. Of course, now, during the pandemic, for public health purposes and the health of the people inside, but also because it's not necessary. This is what I meant in the beginning by exposing the bad decisions that we've made over the years. Just putting people in prison for life without parole does not serve any public safety purpose, because people who are elderly, people who are over 50, over 40, they're not a public safety danger. And we kid ourselves when we make that the rationale. They're in there because we are getting retribution. And we have to make some hard decisions in this country about how much of that we want versus the humanity that we're throwing away, just like Professor Velez Martinez just told you. Decisions are being made like that all the time. We're just seeing it now in terms of the pandemic, but we've been doing it in the criminal legal system for decades. We've been throwing human beings away and pretending that it doesn't matter. Well, it does, and it turns out now it matters to everybody. So where are we? Are we doing any of this? In the few minutes I have left, let me just give you a couple of news nuggets here. I called these from the Marshall Project. If you're not reading the Marshall Project, it is the single best source that's out there now for news on the criminal legal system. By April 29th, 15,000 people in prisons nationwide had tested positive, and this is with almost no testing going on. Some localized figures: Ohio showing a rate of 8,000 positive cases per 100,000 people. That number's a little weird because they don't have 100,000 people in prison, but it's a rate of 8,000 per 100,000. 29 deaths, that's a rate of 59 deaths per 100,000. Pennsylvania, how do we compare? We're testing almost nobody. That's how we compare. 107 known cases per 100,000. That just cannot be right. 7 deaths per 100,000. Prisons in Kansas, Mississippi, South Carolina, all struggling with COVID outbreaks. South Carolina corrections officials asking for the National Guard. Palestine, Texas, one of these towns with 5 state prisons. A great job creating industry. Well, now the town is being overrun with COVID. Vermont, a judge trying to work out releases from state prisons, stopped by prosecutors and state legislators. What about on the jail side? People should not be in because they can't afford bail. It's just not right in any time. Now it's crazy. Now it's just crazy because we're infecting them and they're infecting us, and around we go. In Allegheny County, we have released 1,150 people from the Allegheny County Jail, but that still leaves well over 1,600 as of April 28th. 19 reported cases of COVID-19 up to that point. In jails across the country, federal courts are stepping in to prevent passing out of masks, to prevent passing out of soap. Thousands of jails in place, thousands of people in jails in Illinois and Louisiana who have been paroled can't get out because the necessary final paperwork or coursework or whatever it is, programs, cannot be completed. So I'm going to stop there and just say again, what we're seeing now is the exposure of problems that have been there for a long, long time, and they're all getting worse. I want to thank Professor Pierson-Brown and Professor O again for putting me on this panel. I have really learned a lot.
All right, thank you so much, Professor Harris. That was really informative, and we actually do have some questions that came through for you. In the interest of time, though, I do want to turn it over to Professor Crossley, and then we'll circle back at the end for questions from the audience. So, Professor Crossley, please share your remarks with us at this time.
Great, thank you. And I want to echo the thanks for the organizers for this program, which I've learned a lot from, and I think we've been hearing a lot of common themes and will continue to. I teach health law and policy, and a lot of my research has had to do with inequality in healthcare settings. And so watching the pandemic unfold has been at the same time fascinating and horrifying from my perspective. There are a lot of things I could talk about that fall under the umbrella of COVID-19 and health law, but I want to just focus on one of them. And for some reason my slides are not advancing. Let's try this. Okay, so several topics I'll talk about. We'll be looking at the exercise of public health authority, access to health insurance coverage, and then a couple of issues relating to health inequality, racial health disparities, and the potential for disability discrimination in the rationing of scarce medical equipment. And I think a good place to start is by highlighting the distinction between the public health system and the healthcare system. So the public health system is the system of government agencies that really tries to prevent, in the context of this pandemic, tries to prevent people from getting COVID in the first place. Whereas the healthcare system is the system that treats people once they need treatment, once they need testing or treatment. And the law makes that distinction as well. So let's just start by thinking a little bit about public health law. This is the area that addresses questions that arise about the scope of the authority of state, federal, and local governments to take actions that may restrict the liberty of individuals and of organizations like schools or businesses in order to safeguard the welfare of the broader community. Now, the president and all 50 governors have declared health emergencies, but actually in the context of public health, the states take the lead here. That's where most of the power lies. The police power to preserve the public health and welfare is definitely one of the powers that's reserved to the states under the 10th Amendment of the Constitution, whereas the federal role is really, by and large, limited to steps to try to prevent the interstate spread of disease or to try to prevent entry into the country of persons from abroad who might be infected. Given the rapid spread of COVID-19, state health authorities have well-established power to order the shutdown of places, including schools and businesses, where people come together, where they congregate. But that power can't be wielded in a way that is arbitrary or unreasonable. Governors and local health officials also have power to impose stay-at-home orders for the general populace in order to try to minimize the transmission of the virus, as well as to preserve health system capacity, what's come to be known as flattening the curve. And if stay-at-home orders are challenged in court, the question will be whether states can show that large-scale restrictions on personal movement are proportionate to the health threat that's before us. And that has to be based on the best available scientific evidence. In fact, in Pennsylvania, there has been litigation where plaintiffs who were a golf club, some realtors, and a political candidates campaign went to court to challenge Governor Wolf's order on state and federal grounds. But the Pennsylvania Supreme Court, in a decision issued on April 13th, found that the business shutdown order was a proper exercise of the governor's police powers pursuant to what was declared in Pennsylvania as a natural disaster. Now, as it turns out, the plaintiffs in this litigation have made an emergency filing in the US Supreme Court asking it to suspend Wolf's order. Just Monday of this week, Pennsylvania filed a response to the plaintiffs upon the direction of Justice Alito. Not clear when the court will actually take any action on this emergency filing, but similar litigation is going on challenging stay-at-home orders or business shutdown orders in other states as well. I heard just yesterday on the radio that there's litigation going on in Wisconsin. So that's public health law. But when we start thinking about healthcare law, we're thinking about the body of law that applies to the system for paying for and delivering healthcare to patients. And certainly we've all heard about the pandemic and how it creates extreme challenges for doctors and hospitals because of the volume of patients in areas that have been hit hard by the pandemic, as well as because of the need for extreme infection control measures that they have to take in providing care. But the pandemic also poses challenges for people, for individuals who need care and may not be able to get it. And one big barrier to receiving care is the lack of health insurance. Now, even before the pandemic, there were about 27 million Americans who didn't have health insurance. And since the pandemic hit, millions more have lost their health insurance coverage when they lost their jobs. The pandemic in this sense is really shining a light on the cobbled together nature of our health system, health insurance coverage system. If people don't have health insurance, they're less likely to go and try to get a test if they're not feeling well. And if they're sick, they're less likely to try and go get treatment. And certainly that can have negative effects for the individual involved because they may not get the care they need. From a public health perspective, it also makes it harder to prevent transmission of the disease when people get sick. So what can people do if they don't have health insurance now and they think, ooh, might be a good time to get it, right? So if you if you've lost a job and lost health insurance as a result of that, there's a law called COBRA that permits you to be covered by your former employer's health plan for a limited period of time. So that's one option. You can stay on your old plan. Problem is, you have to pay the full cost. There's no employer contribution for you once you're no longer employed. And paying the full cost of coverage may be difficult if you've recently lost your job. In addition, for employers that go under as a result of the pandemic, that plan may not be around anyway. Another option would be to buy health insurance coverage on one of the health insurance exchanges, also known as Obamacare. And this may be a good option. This is the healthcare.gov marketplace. And if your income is less than 400% of the federal poverty level, you'll actually get a subsidy to help you buy this coverage. Now, ordinarily, purchases on the exchange can only be made during an annual open enrollment period, which usually happens around the holidays. But if you lose your job, that's a triggering event that lets you buy coverage on the exchange, even if it's not the annual enrollment period. But for people who didn't have coverage prior to the pandemic, or maybe had a non-ACA compliant plan, like a short-term health insurance plan, and now they're wishing they had some coverage, they are not going to be able to buy insurance on the federal exchange. At one point, the president was considering making a special open enrollment period during the pandemic so that anybody could go to the exchange to get insurance, but he decided not to. Another option for getting coverage for some people is Medicaid. If your income is less than 138% of the federal poverty level, then you can enroll in the Pennsylvania Medicaid program at basically no cost. Now, it used to be that only certain categories of low-income people could enroll in Medicaid, like people with disabilities or families with children. But one of the big innovations of the Affordable Care Act was the expansion of Medicaid to cover everyone below the 138% income threshold. Now, talking about health insurance coverage provides me with a nice segue into looking at health equity and health disparities. And when we're talking about health disparities, we're talking about differences between demographic groups in their health status or in healthcare quality, access, or usage between those groups. And racial health disparities have been a profound and persistent problem in the United States across a wide range of measures. One of those is insurance status, with Black Americans being insured at rates lower than white Americans. And if you've been following the news, you've undoubtedly seen references to shocking disparities in the number of cases and deaths suffered by Black Americans from COVID. Just to give a couple of examples, it was reported recently in data from Michigan that while Black people make up 13.6% of the overall population of Michigan, they accounted for 40% of the deaths from COVID-19. In Louisiana, the numbers are that Black people make up 33% of the state's overall population, but 57% of the confirmed deaths in that state. Now, there are many explanations for why Black people are more likely to get sick with COVID and are more likely to die. And this ties in with the points that Professor Velez Martinez was making. You know, these include explanations like the fact that Black people are more likely to have public-facing service jobs where they can't work from home, but they have to go out and interact with people. The fact that sources of air pollution, which have been shown to exacerbate COVID infection, are disproportionately cited near low-income Black and brown neighborhoods. And the fact that, in another example of health disparities, Black Americans have higher rates of health conditions like diabetes, heart disease, and obesity that make COVID more dangerous. But low rates of insurance coverage is also a factor. And this is actually particularly of concern in the southern United States now. And here the law comes into play again. You may recall that the first big challenge to the Affordable Care Act that went to the US Supreme Court was a case called NFIB versus Sebelius. And one of the court's holdings in that case was that the Affordable Care Act's requirement that states expand their Medicaid program was unconstitutionally coercive to the states. And rather than strike it down entirely, the Medicaid expansion, the Supreme Court effectively made the expansion requirement in the ACA, it made it optional for the states. Now, currently, 37 states, including DC, have chosen to expand Medicaid so that anybody who meets the income threshold can get health insurance coverage. But a majority of southern states, where Black people make up a larger share of the population, have chosen not to expand Medicaid. And these refusals to expand leave low-income residents uninsured and more subject to the devastation of COVID. And this graphic that I put on the slide shows you in the states that are shown in the darker blue, those are the states that have higher percentages of their population that is Black. The states that are outlined in red are the states that have not chosen to expand their Medicaid program. And so this is one of the reasons why we have seen headlines like this one that really look at the perfect storm created by poverty and race in the South, and the likelihood of a devastating toll in that part of the country. And from a kind of legal and political angle, you know, there actually are things that states could do. Any of these states could choose tomorrow pretty much to expand their Medicaid program. And do so quickly. There's also been legislation proposed by Senator Kamala Harris to create a federal task force on coronavirus racial disparities, as well as actually a similar proposal by Pittsburgh City Council member Ricky Burgess for a local task force along the same lines. So I want to just wrap up now by talking about one more health equity concern where the law, specifically disability discrimination law, has actually already had some effect during the pandemic. So many people with underlying health conditions that make COVID infection more dangerous are people with disabilities. And disability advocacy groups started raising the alarm early in the pandemic when discussions began in medical circles about a potential need to allocate or ration scarce medical resources like ventilators in case the health system became overwhelmed and couldn't have resources enough for everyone. And the concern was that rationing schemes for deciding who would get ventilators would discriminate against people with disabilities. And indeed, a few states had in their allocation guidelines categorical exclusions or low prioritization for people with certain disabilities or functional limitations. After complaints were filed by disability advocacy groups, the Office of Civil Rights at the Federal Department of Health and Human Services has taken action in a couple of cases, leading to changes in those guidelines. For example, the state of Alabama removed its reference, a reference in its policy to intellectual disabilities as a basis for denying ventilator services. There was also a complaint, interestingly enough, filed against the original version of Pennsylvania's allocation scheme. And in response to that complaint, Pennsylvania has agreed to make explicit in its allocation scheme that not only should there be no categorical exclusion based on any disability or any pre-existing health condition, but that allocation decisions should be based on an individualized assessment of a patient's condition and should not incorporate any consideration of a patient's quality of life. After those changes, the OCR considered the complaint against Pennsylvania satisfactorily resolved, although there are still some parts of Pennsylvania's policy that disability advocates aren't satisfied with. But I do want to note that this actually is an area where in short order, disability discrimination law has had an impact on how these discussions are proceeding. And I'll just close by echoing the idea that's come up before, which is that this pandemic really is forcing us to see the inequity in health more clearly than perhaps we have before. And to my mind, the real question is, what kind of legacy will our responses to this moment in time leave? Will we leave the pandemic moving towards a more just society or towards further entrenchment of disparities that have existed for a long time? So thank you.